Have you ever wondered what happens if you abstain from ejaculating for a long period of time? This is a very common question, and not only among young men, but also among many who already have more years of experience. And as surprising as it may sound, this topic continues to be a subject of debate. It is possible that ejaculatory abstinence may have negative effects on sexual and reproductive health. Today, we are going to address this question in depth, exploring what really happens inside the body when this very natural process is delayed. Hello, I am Dr. William, a urologist, and today I am going to explain what happens when the body does not eliminate sperm in the way it is designed to do so. The first thing you need to know is that this topic has been studied on several occasions, and although some of these studies have left more questions than answers, I am going to break down the key points so that you can understand them clearly. In a study conducted by Harvard University, it was found that men who ejaculated 21 times per month had a lower risk of developing prostate cancer, up to 30% less. But before jumping to conclusions, we need to analyze the details of this study. To begin with, this was not a clinical trial that followed participants over a long period of time. It was a retrospective study, which means that patients were analyzed in the present based on data collected from the past. Although the study is interesting, it must be taken into account that retrospective studies do not always have the strongest level of evidence. Why is that? Because they may be influenced by biases such as patients' memory or how the data was selected. This makes it difficult to reach definitive conclusions. However, what this study does show us is something important. The relationship between ejaculation frequency and prostate health deserves further attention. So, should we really worry if we do not ejaculate for a long time? The short answer is not necessarily. The human body is incredibly adaptable. If for some reason sperm is not released voluntarily, there are natural mechanisms that take care of it. One of these mechanisms is nocturnal emission. This is an involuntary form of ejaculation that occurs during sleep without the need for sexual stimulation. It may be uncomfortable, but it is not something that should concern us in terms of health. In addition, another phenomenon that can occur is epididymal congestion or discomfort in the scrotal sac when sperm has not been released. Although this can be unpleasant, it also does not cause serious harm. But what happens when no form of ejaculation occurs for a long time? This is where the magic of the human body truly shines. The production of sperm and seminal fluid continues to occur constantly, but if they are not released, there is no dangerous accumulation or anything that causes an immediate negative impact. What happens instead is that the body recirculates this material. This is a process that involves apoptosis, or programmed cell death, and reabsorption. Old cells are recycled, and new cells are produced to maintain sperm production over time. Therefore, the body finds ways to manage accumulation, and there is no evidence to suggest that this causes long-term harm. But wait a moment. This is only part of the story. Because although the body adapts well and there is no evidence that lack of ejaculation causes serious physical health problems, there is something that can happen. I invite you to stay with me, because what I am about to say may surprise you. If abstinence becomes a lifestyle that affects psychological health, the impact can be completely different. But what happens when the focus is not on physical health, but on mental health? When we talk about psychological health, things can become a bit more complicated. Although there is no direct connection between ejaculation abstinence and long-term physical health problems, the psychological impact of maintaining prolonged abstinence can be deeper than you think. Imagine that the desire to ejaculate or to have more frequent sexual activity becomes an obsession, something that constantly occupies your mind. At that point, the situation can shift from being a personal choice to becoming a real emotional challenge. The body may adapt to the lack of ejaculation, but the mind also has its limits. Men who feel pressured because they are unable to meet social or sexual expectations may experience stress, anxiety, or even depression. This is something that is not always visible, but it is present in many cases. The idea that ejaculation frequency is a measure of virility or sexual health is a myth that has persisted for years, and many men feel trapped by it. This type of mindset can create a negative cycle that affects overall well-being. So how can we break this cycle and live a healthy sexual life without falling into the trap of obsessing over ejaculation? The answer lies in understanding that sexual health should not be measured by the number of times you ejaculate per month. Instead of focusing on numbers, We should pay attention to the quality of sexual life and the relationship we maintain with our partner. A fundamental aspect of having a fulfilling sexual life is emotional connection, not just physical aspects. When we understand this, we realize that sexuality is much more complex and richer than simply meeting certain physical expectations. Of course, this does not mean that ejaculation is not important. Ejaculation is a natural and healthy function of the body, but it should not be seen as a goal that must be achieved at all costs. It is also important to point out that abstinence should not be used as a tool to avoid sexual dysfunction. Erectile dysfunction, for example, can be a much more complex issue than simply a lack of ejaculation, and it can be addressed with therapy, exercise, and better communication with one's partner. By following this approach, we can better understand the dynamics of our sexual health. Not ejaculating for a long period of time should not generate guilt or fear. The body is designed to adapt and, as mentioned before, it can handle this process naturally. However, there is something you should keep in mind if you are considering abstinence as a lifestyle choice, because if it is not done consciously, there could be unexpected consequences. We will talk more about this shortly, but before continuing, I want to make sure you understand something very important. The key here is not just how often you ejaculate, but how you feel about yourself and your sexual life. In fact, there is a way for men to improve their sexual health without needing to rely on masturbation or frequent sex. This has to do with a concept that may be revealing: pelvic floor muscle exercise. Did you know that this type of exercise can strengthen the pelvic area and improve circulation, which in turn can benefit your sexual health? This is just the beginning of what we are going to explore. It is surprising how some simple exercises can have such a big impact on sexual health. Pelvic floor muscle exercises not only improve blood circulation, but can also help prevent problems such as erectile dysfunction and muscular atrophy. This is an excellent way to take care of your body without needing to maintain a constant sexual routine, which can relieve the mental pressure associated with abstinence. In addition, pelvic floor physiotherapy can be incredibly beneficial. This type of treatment can increase oxygenation and vascularization in the area, helping to maintain proper functioning of the reproductive system. All of this can be done without resorting to extreme or expensive methods, and the best part is that it can be done in the comfort of your own home. Now, when we talk about male sexual health, we cannot forget that psychological well-being is just as important as physical well-being. Stress, anxiety, and concerns about performance can be just as harmful as any physical factor affecting sexuality. The key is to maintain a balanced approach and not obsess over ejaculation frequency or the number of sexual encounters. Sexual health is about connection, communication, and comprehensive care of both body and mind. Finally, if you ever find yourself questioning ejaculation, abstinence, or any other aspect of sexual health, remember that you are not alone in your concerns. Many people have doubts about how to manage these topics, and it is completely normal to seek answers. Make sure to speak with a professional if you have questions about what is right for you and your health. Thank you for staying with me until the end. I hope this video has clarified your doubts about what happens if you do not ejaculate for a long period of time and how to manage sexual health in a healthy and balanced way. If you found this content helpful, do not forget to share it with others who may benefit from this information. And of course, subscribe to the channel, turn on notifications, and stay tuned for our upcoming videos.